Good morning, friends. Good afternoon to Dr. Hans Lanz from Munich, Germany, who has agreed kindly to tell us what the situation with the coronavirus is in Germany. So, good afternoon, Hans. How are you?
I'm very well, thank you. I'm happy to speak to you, Nancy, and thanks for running this short interview.
Thank you very much. What is the current situation in Germany with the coronavirus epidemic?
Yeah, recently we've been in quarantine for about 4 weeks now here in Germany. Measures called social distancing, or I rather call it physical distancing, which means you should only go out with members of your household or family members, not more than two people at a time. And also in the public space, you should keep a distance of about 5 to 6 feet or 7 feet from other people while you shop or do your activities outdoors. The businesses have all been closed down a couple of weeks ago, except for the essential businesses. And of course, this had a significant impact on families and the economy as a whole, as you can understand. The current situation really has made a turn. We're currently seeing less daily new cases than in the last week or other weeks before. So the virus spread is slowing. The so-called R rate is below 1. So that's the rate that typically describes how many individuals are infected by one positive COVID-19 positive individual. That number used to come down from about 3 to 2 and now is below 1 at about 0.7 in Germany. This means that one person is infecting less than one person. And of course, this is a change in trend. And so this is very hopeful that we be able to contain this pandemic.
Do you think?
If we keep the measures.
Yes, actually, I was going to ask you. Do you think that the social or physical distancing, as you were calling it, has helped to curb the epidemic?
I think this was probably the most important measure that was done. That people have less and less contacts, physical interactions, and we've seen real spurs and spikes of the pandemic in areas where people were congregating. For example, people were at so-called Mardi Gras or Carnival events where hundreds of people were together in a big ballroom and celebrated together, and then there was a huge spike in infectious cases, or people spending vacation together, skiing in the Alp resorts, and then returning back to their homes and then spreading the virus there. So that is probably the most effective measure so far. It is also a measure in times where we are short on protective devices, where we don't have enough masks, let alone the FFP2 or FFP3 masks, which are really the most effective ones. Even the shortages is affecting hospitals and nursing homes and elder care facilities.
So
that is pretty dramatic.
I think what I'm hearing is that the worst is over, but it's not totally solved yet.
The worst may be over for Germany. We're very fortunate. I think we had very early action with testing and following up on infection pathways and isolating individuals who might have been infected. So this was very effective. The government did a good job. There's a great consensus and support from the public for the measures that the government took. There's a high agreement rate, which is normally not so usual, but in this circumstance, since it was very well explained, also with experts and different experts from different fields, what needs to happen in order to really stop the rapid increase in cases every day. And I think Germany was fortunately very successful. While we're gearing up, of course, with providing enough intensive care beds and respirator places and so forth. The only thing that is really still somewhat in shortage is protective masks. So we have also introduced a recommendation in some towns and states, actually a mandate to wear a face mask, and those are typically makeshift. What is called a community-made mask covering your nose and mouth, particularly when you go into a supermarket or be indoors, or if you travel on the public transport. That is a recommendation at the moment. And this is because we don't have enough surgical masks, or let alone higher grade masks, to give out to the public.
Are you discussing any means to get back into the whatever's going to be our new normal? How are you discussing getting back into society? Are you going to do that all at once, or in waves, or?
Well, first it is fairly coordinated. Of course, we also have a federal system with states, and ultimately the governors of the states are or the states ministers are the ultimate decision makers. In some areas are more hard hit, like Munich. I'm in Munich, so Bavaria is a southern state in Germany, which has one of the most cases per population, compared to other states more in the north, which are not as heavily affected. So there are slight and minor differences, but in general, the federal government tries to align with the state governments, and the measures taken are kind of taken in lockstep. And we just started a discussion because now after April 20th or early May, we're gradually starting to open up businesses again. Some businesses will open up. Non-essential businesses were all closed or are still closed until April 20th. So some businesses are going to start up with certain protective measures, and that is again physical distancing. So stores will open up only up to a certain size, 800 meters square. Stores, anything above is not allowed to open up, and there will be a limited number of customers in the store, not more than one person per 20 meters square. So really trying to contain and allow for the distancing. And of course, then the recommendation to wear masks and so forth. Big discussion is about opening preschool, kindergarten, and schools again. And there was a recommendation from the National Academy of Science in Germany. It's called the Leopoldina, which is a group of about 25 scientists from all backgrounds. They recommended to let younger children back into school first. But I think rightfully so, the government decided, also with the advice from experts, to do the opposite and start with higher second grade school first, and allow those who are at the end of high school to get their high school diplomas and then move on to university and so forth. So they'll take a very cautious and stepwise approach. The classrooms will be downsized from about 30 students to 15 in order to allow the distancing. There will be no sports activities or communal activities in the cafeteria, etc. So they try to really also impose the social distancing or the physical distancing in schools. And of course, that's almost impossible in preschool and kindergarten.
Right.
And that's why still waiting to open up those kinds of facilities.
Well, thank you so much, Hans, for this. I think that we need to look at you and other countries that have been through this before we have, and we need to learn from the lessons that you are teaching us as to how to have the physical distancing, how to confine ourselves, and how to slowly open up in a measured way, very carefully and very thoughtfully. So thank you for sharing your experience, and I hope to see you soon again.
Thank you, Nancy. It was a pleasure talking to you.
Likewise.
And stay healthy.
Thank you.
Bye-bye.
You too. Goodbye.